Mr. Julien Guillemette has been hospitalized for gallbladder removal. He is very much in pain at the present moment. After preparing the narcotic analgesic, 75 milligrams of Demerol, the nurse goes to the client's bedside to administer the drug into the front gluteus site. The nurse proceeds with hand hygiene before entering the client's room in order to comply with the mandatory infection prevention measures.
Hi, my name is Philip, and I'll be your nurse today. I'm here to give you your sedative. So just to confirm, can I have your full name as well as your date of birth, please?
Julien Guillemette. My birthday is November 10, 1990. I'm so happy to get a sedative now. I'm in a lot of pain.
Okay.
It is compulsory for the nurse to ask the client for his name and date of birth and validate them with the ones on his bracelet. This double identification approach decreases the risk of making mistakes.
Okay. Get you, if I can, I'm going to need you to turn on your side, facing towards me. Can you do that?
Yes, if you help me a little bit.
Okay, here, come here. There we go. And if I can get you to bring your knee up towards your chest.
Yeah.
Perfect.
To pinpoint the ventrogluteal site, the nurse places the palm of his hand on the greater trochanter of the hip. He asks the client to flex his upper knee towards his chest. This will bring the trochanter to protrude, thus making it easier to locate. Using his index finger, he finds the front iliac and stretches his middle finger along the crest of ilium towards the client's buttock. The injection must be administered in the middle of the triangle formed by the index finger, the middle finger, and the crest of ilium. He takes his non-dominant hand to extend the skin and disinfects the site all the way to its periphery, using a spiral movement over an area of 5 centimeters. A spiral movement is used to prevent the already disinfected area from being recontaminated during disinfection. He then leaves the antiseptic dry for 30 seconds.
Okay, so take a deep breath.
The nurse quickly and steadily inserts the needle at a 90-degree angle. This will decrease the pain felt by the client during the injection of the medication. He then stabilizes the syringe before proceeding with the injection. He does so by placing the thumb and the index finger of the non-dominant hand on the lower part of the syringe. Before injecting the medication, the nurse gently pulls on the plunger to make sure the needle is not in a blood vessel. Doing so enables him to make sure that the medication is not being injected intravenously, but intramuscularly as it should be. He then injects the medication slowly to reduce discomfort and minimize trauma to surrounding tissues. Once the injection is done, the nurse withdraws the needle, making sure to keep a 90-degree angle with the surface of the skin. This will avoid causing damage to the tissues. He will then put a dry gauze on the injection site and apply a light pressure to control bleeding and prevent the medication from flowing back out.
Okay, so let me get you comfortable. Get back into a comfortable position here. There we go. Okay, how are you feeling now?
I'm okay.
Okay, so if you feel any discomfort, feel free to use the call bell and we'll come and see you. But in the meantime, I'll be back in the next 60 minutes to see how well you're doing.
Great. I feel nice and comfy now. Thank you very much.
Perfect.
Around 60 minutes after administering the sedative to the client, the nurse will return to his bedside to verify the level of efficiency of the medication and measure his vital signs. Once the medication has been administered, the nurse fills out the patient's drug administration sheet and notes any particularities down in the client's file.